Well, welcome everyone, and thank you for joining us for this quarter's data and performance management meeting. Today we'll be covering the project performance report schedule and overview, the emergency shelter, street outreach, and homelessness prevention PPRs, the quarterly data quality report cards, and we will facilitate a discussion on the question, should physical address of housing placement be tracked in HMIS? This is the publishing schedule for the project performance reports. PPRs are published twice a year for each project type. So for example, the street outreach PPR is published in August and February, and you can see the reporting periods used for each publication. The project performance reports include all projects that participate in HMIS and highlight different measures that HUD and the COC have determined are important in effectively ending homelessness for Orange County clients. The project performance overview document provides detailed information on the goals and what goes into each goal, and that can be found on our website under the Reports tab or in this link made available in the slides after this meeting. For this quarter, we're highlighting recently published emergency shelter, street outreach, and homelessness prevention project types. So we wanted to review the goals and outcomes overview page in case folks aren't familiar with it. This page shows the goals over time so we can easily compare the current goal scores with previous performance from past reporting periods. So starting at the top, the first gold oval indicates the reporting period. Moving down, the second oval identifies the color coding used to indicate whether the goal met or did not meet the threshold. And the third oval shows the goal number, the title of the goal, and the current threshold in parentheses. The dashed line in the fourth oval represents the threshold line that the COC has established for that particular goal. Note that the bars reflect the 6-month reporting period for the project type. And finally, for the last oval, we wanted to point out that unlike all other goals, Goal 10, which is ensuring clients do not return to homelessness after being housed, uses 2 years worth of data as opposed to the 1 year used for other goals. So we'll start with the emergency shelter PPR. Andrew?
Hey everyone. For this project performance report, we're looking at emergency shelters and all of our ES projects that were active in HMIS for the reporting period May 2023 to April 2024. And for this reporting period, our COC met 3 out of 7 thresholds for this project type. And the first goal was prioritizing clients experiencing literal homelessness. We had a threshold of 100%, but we had 88% of clients entering from literal homelessness, and we've noticed fairly consistent performance in this goal over the past 2 years. Goal 2 is decreasing length of stay in ES projects. We have a threshold of 30 days, but for this reporting period, we had an average length of stay of 132 days, and we've noticed an increase in this goal over the past 2 years. Goal 5 is looking at bed utilization, and we have a threshold of 70%. And for this reporting period, we met our threshold, and our bed utilization was 89% for the past year. Goal 6 is looking at increasing income while enrolled in the project. And the thing about Goal 6 is it's only looking at enrollments that have been enrolled in ES projects for a year or longer. We've met this goal and we've been fairly consistent in meeting this goal. This reporting period, we had 20% of those clients increasing their income, which is meeting our threshold of 15%. Goal 7, which is a little more relevant to ES projects, is increasing income as of project exit. So this is looking at their income as they exit versus their income during project enrollment. And we've had 8% of clients for this reporting period meet the or increase their income, which is not meeting our threshold of 15%. Goal 8 is helping clients exit to successful housing situations. And we've noticed fairly consistent performance in this goal, um, even a slight increase over the past 2 years. But we're not meeting our threshold of 30%. We had 24% of clients exit to successful housing situations this reporting period. And then our goal 10 score for emergency shelters was 6% for this reporting period, which has remained fairly consistent over the past 2 years. And we've been fairly consistent in meeting our threshold of 10%. Um, oh, and before I move on to like looking at the goals in more in depth, did anyone have any questions about the emergency shelter goals or the PPR in general?
Please feel free to unmute yourself if you have a question, or you can also add your questions in the chat.
Okay, I'm not seeing any questions, but yeah, feel free to leave it in the chat if you have any. So the goal I wanted to look at specifically for emergency shelters was goal 2, which is decreasing length of stay. And for this past reporting period, we had a project type score of 132 days, which is significantly higher than previous reporting periods. And we've noticed that this number has been steadily increasing over the past 2 years. And one of the things that I wanted to point out about goal 2 is that our length of stay calculation is based on a client's project enrollment date and their project exit date in HMIS. But for clients who have stayed enrolled in emergency shelter continuously, we actually use the end of the reporting period as their project exit date. Um, and that's part of the reason why we've seen an increase in this goal is because the clients who have been enrolled in ES projects for extended periods of time have just been driving up the average, and that disparity has been becoming larger over time. And what I wanted to try to show in this weird looking graph on the right was the distribution of the different length of stays we have in HMIS. Um, so as you can see, we have enrollments in emergency shelter projects that are as long as 2,000 days, which is about like 5 or 6 years in an emergency shelter project. And that does suggest a couple things. One is that there are projects in HMIS that have different program operations and may allow for enrollments with significantly longer length of stays. But it also suggests that there might be some data entry inaccuracies that are occurring in HMIS. And I did want to encourage AAs and HMIS users to take a closer look at enrollments that have been active for a long period of time, especially when it comes to emergency shelter enrollments, because if you have a client and you didn't exit them, it's going to impact your goal 2 score a lot just because it's going to bring up that average length of stay. Uh, the next thing I also wanted to mention about goal 2 is that we've seen a fairly consistent performance regardless of the subpopulation we're looking at. So, for example, those experiencing chronic homelessness and veterans have a fairly similar average length of stay to the rest of the project. The only sort of outlier we have is households with only children, which had an average length of stay of 14 days. But that's mainly due to the very low sample size for this project type. So there's only about 2 or 3 projects in our COC that have this type of bed inventory, which is why we see such a big difference in the length of stay. But that's pretty much all I wanted to talk about for goal 2. If anyone had any questions about goal 2, feel free to leave it in the chat.
Andrew, I'm not seeing any questions.
Okay, cool. We can go on to the next slide then. Okay, so for this goal, goal 5 is looking at bed utilization for emergency shelter projects. And we've been meeting this goal every reporting period for the past 2 years. So for this reporting period, we had a bed utilization score of 89%. And that means that of all emergency shelter beds that were active in HMIS, 89% of them were occupied. And we've seen fairly consistent numbers across the different household types, with the exception being households with only children. So that's kind of also explained by the very low sample size, and there's only 2 or 3 projects in our COC with that type of bed inventory. So we can see that there's just less of an occupancy rate for that type of project. Um, but another thing I wanted to highlight was that we do have some projects that are reporting a very low utilization score of under 70%. And that suggests a couple of things. One is that it could just be low utilization, but it could also be that the bed inventory is not up to date in HMIS. And so I highly encourage AAs that if they notice that their utilization score is not reflecting what they see at their emergency shelter, that they, reach out to us, submit a ticket. We try to send you the bed inventories every time we make one of these PPRs. So it's really important that the bed inventory that we have in HMIS accurately reflects the bed inventory of the project itself. And this is also something that we're going to be reaching out to agencies in the upcoming months for both LSA and HCPIT. So yeah, we highly encourage A's to submit tickets whenever there's a change in bed inventory or they notice the bed inventory is different in HMIS. And also minor day-to-day fluctuations are not considered bed inventory changes, but difference due to like significant changes in project operations should be recorded.
Andrew, for those notes, wanted to also let our HMS agency admins and users on the call know that we do have an agency setup review dashboard and a KB is added into the chat. You have access to this report and you can run it whenever you need to review your agency project setup. As Andrew mentioned, it includes your bed inventory, so it's important to ensure that if there's any changes that you review the dashboard to make sure it reflects your current project operations.
Yeah, thank you, Andrew. And I also wanted to point out that Elizabeth put in the chat links to the project performance reports and the project performance report overview document that we discussed a little bit earlier. So the next project type we'd like to discuss is the street outreach PPR. The street outreach project type is a project type that offers services to those experiencing unsheltered homelessness, connect them with emergency shelter, housing, or critical services, and provides urgent non-facility based care to those who are unwilling or unable to access emergency shelter, housing, or an appropriate health facility. So the key to this is only persons who are residing on the streets or in places not meant for habitation should be entered into a street outreach project. So this is our most recent report for street outreach for the reporting period of June 1st, 2023 to May 31st, 2024. And for this reporting period, our COC met 3 of the 4 goals, a 2-goal improvement over the previously published street outreach PPR, in which only 1 goal was met. So we wanted to highlight this achievement. So goal 1 is prioritizing clients experiencing literal homelessness. It was not met, but it did stay steady from the last publication at 93%. And you can see our threshold is 100%. So goal 2, which is decrease length of stay in temporary shelter and outreach, was met. So the data shows that we're keeping below the threshold after an increase in February 2024. Another Met goal was seen in Goal 8, which is helping clients exit to successful housing situations. And you can see that we have reached that threshold of 20%. And finally, Goal 10 was met, which is ensuring clients do not fall back into homelessness after being housed. We're still stable under the threshold at 8%. Does anybody have any questions about this? Feel free to unmute yourself or enter your question into the chat. Okay, I'm not seeing anything, so we'll go on. So for this project type, we wanted to highlight Goal 1, which is the last goal in order to meet all 4 street outreach goals. We're falling shy of this goal and wanted to bring up some possible issues. So this project type should only be collecting data from clients who are unsheltered. So coming from a place not meant for habitation. And you can see by the donut chart here that this data is including clients who had been sheltered. So some are coming from an institutional setting, some from a temporary situation, and some from a permanent housing situation. So some possible issues are with the prior living situation. Clarify for each participant that the prior living situation is literally the night before enrollment. If the client came from a sheltered situation, consider that the client should be rolled into a different project type, such as a services-only project, which does offer supportive services to sheltered clients. But finally, the chart shows a large quantity of missing responses. Review the missing responses and update with correct data if possible. So we'll pause for questions on this. Okay, I'm not seeing anything. And we'll move on. So the next PPR is homelessness prevention. Linda? Linda, if you're speaking, we can't hear you.
Okay, sorry. So for the homelessness prevention PPR, our COC has met 3 out of 5 of the thresholds for our homeless prevention projects. These goals are measuring the project performance for all of the homelessness prevention projects in HMIS during the reporting period of July 2023 to the end of June 2024. So based on these charts here, the projects have been consistent on meeting the same goals as it has been for the previous reporting period, such as Goal 6, which is helping adults increase their income while being enrolled in the project, and also Goal 7, similar to Goal 6, which is to help increase their income at project exit, and also Goal 10 to ensure that clients do not fall back into homelessness after being housed. So one of the highlights that I wanted, or one of the goals that I wanted to highlight, was Goal 3, which looks to decrease the length of stay for clients in homeless prevention projects. For this reporting period, the average length of stay for clients is 268, which is a little high, as the threshold for homelessness prevention projects is less than or equal to 60 days. So looking at the previous reporting periods, this is a goal that our CLC has been struggling to meet, as it's been ranging from about 245 to 70. So I kind of wanted to open up to discussions for homelessness prevention providers, to just give us some insight as to why clients are being enrolled in HP projects for a long amount of time, and what can be improved to help to decrease the length of stay for clients.
Yeah, feel free to unmute yourself or ask your question in the chat.
I added my question in the chat, but I will also unmute myself. So is there a capacity to update this goal? Is this a COC, 60 days, is that a COC decided number or mandated by HUD? And the note I made is that post-COVID, which was more fast-paced grants, any funding that we are receiving now for homeless prevention is aimed at long-term stabilization of the family, which is longer-term families. So that might be contributing. I don't know if any of our projects are like over 200 days, maybe a couple. So that might be contributing. So I was just wondering, how do we adjust the goal to meet the funding that is in the community?
We can discuss that here, and update the threshold if needed. Is there like a standard for these types of programs? Like how many days are in the contract?
I don't know about the other agencies, but that's the difficult part, is there really is no consistency across the contract. Some say 3 months, some say 6 months. Our newer one is a year for some. So I feel like you have a hard job on your hand figuring out what the happy middle is, because they're very different.
Is there any other prevention providers on the call that are seeing similar experiences with their contracts? Any other input to share on this? So maybe what we could do is take it back and look at the data a little more, to see how the prevention projects are performing, and then we can come back to this meeting in the future with the recommendation on for a new threshold for this. So we have a little more time to make an informed decision.
Thank you for your question, and thank you, Erin. Are there any other questions? Okay, we'll move on. Next highlight.
Okay, so another goal that I wanted to highlight was goal 8, which looks to help clients exit to successful housing situations. So for this reporting period and for past reporting periods, the project score for this goal has always been around 90% more or less, when the threshold is greater than or equal to 90%. So, however, for the past 3 reporting periods, we missed the threshold by just a few percentages. So as you can see on the bottom chart below, the chart below, um, so this chart shows the non-permanent exit categories, with missing being the highest number. Um, so the response included in the missing categories are no exit interview completed, data not collected, the client doesn't know, prefers not to answer, and other. So with this, we ask that the agency reviews these missing categories to ensure that the appropriate option is being entered for the client's exit destination. Something that we would like to share per the HMIS data standards is that we record where the client is expected to stay after they complete or stop participating in project activities. So you would select the destination that would closely match where the client will be staying after exiting the project. So homelessness prevention providers could enter in the destinations for clients if they know where the clients are exiting to. So we would expect that most homelessness prevention participants would be where they were when they entered the homelessness prevention program.
Okay, are there any questions on this? Feel free to unmute yourself or enter your question into the chat. Okay, I don't see any questions, so we'll move on.
Okay, last but not least, I would like to highlight Goal 10, which ensures that clients do not fall back into homelessness after being housed from the project. For this reporting period, only 2% of clients, compared to the last reporting period of 4%, who exited from homelessness prevention projects returned to the system, which continuously meets the threshold of 10% or less. So I just wanted to highlight this goal because our COC has consistently achieved it, just to showcase the effectiveness of our homelessness prevention projects and also our commitment to supporting long-term housing stability for clients.
Thank you, Linda.
Yeah.
If there are any questions, feel free to enter them in the chat. We'll wait a second. Okay, I don't see any questions, so we'll move on. The next topic are the data quality report cards. Andrew?
Yeah, so in the next few slides, I'm going to be going over our quarterly data quality report cards. This is a report that we publish every quarter, and it looks at the universal data elements for all enrollments in HMIS that are active during the reporting period. And we look at a couple things, mainly data completeness and accuracy, and data timeliness. And data completeness is basically just how complete is the data, how much of the field is populated in HMIS, and we also want to make sure that the data being entered is accurate. So we look at whether or not the data entered is a valid response and whether it follows the HUD data standards. And then we also look at data timeliness, which is how soon is the data entered relative to when it's available. So we look at enrollment data, service data, and exit data. When is it entered in HMIS, and when did that event take place? And then the different universal data elements that we look at range from universal identifier elements. So these are things like name, date of birth, social security number, and other demographic information. And then we also look at the universal project stay elements, which are all the data that we collect for every project enrollment. These are things like disabling condition, project start and exit dates, and then have household information as well. Can you go to the next slide, please? Yeah, so this is the report that looks at the data completeness and data accuracy for universal data elements for this quarter. And our reporting period for this quarter was July 2024 all the way through September 2024. And for this reporting period, we had an average data completeness score of 95%. Over the course of 41,565 enrollments, which I want to point out that this is a pretty significant increase from last quarter. And we've noticed a fairly steady increase in the number of enrollments in HMIS over time. So even though we're increasing the number of participants in HMIS, we've stayed fairly consistent in our data completeness score of about 95%. So on the right, it shows the different data elements we're looking at, and it breaks it down by how many of the responses were valid, how many were data not collected, and how many were blanks. And as we can see that most of the data elements are being completed at about 95% rate. The only sort of outliers we have are social security number and destination. The thing I wanted to point out about the social security number is that even though it looks like we're only entering 86% of valid responses, the 13% that falls under don't know / prefers not to answer, a large majority of that is actually undocumented enrollments or clients without social security numbers. And so the guidance that we've received from HUD is that if they don't have the social security number available, you would enter don't know or prefers not to answer. And that's a valid response for those clients. The next outlier is exit destination. And a large part of this is because a lot of the times exit destination just isn't data that's collected. So a lot of the times we'll just have data not collected for an enrollment. This is most likely due to just losing contact with the participants and not being able to enter that data. But overall, we've seen a fairly good performance in regards to data completeness over time. And yeah, it's been about 95% for the past few reporting periods. And then in this portion of the report, we're looking at data timeliness. So we have a few different things we look at. One is project entry. That's looking at project start dates. And we also have the services, which is looking at the service dates, and then project exit, which is looking at the project exit dates. And we have a goal of entering in the data within 3 days of when it's available. And we're fairly good at entering the data in HMIS in a timely manner. As you can see, most of the project entry dates are entered within 3 days. But we do see sort of a decrease in data timeliness when it comes to services. So we tend to enter services a little bit later than when they occur. But we've been performing fairly consistently in regards to data timeliness. And this dashboard is just looking at the average number of days for each different category.
Well, thank you, Andrew. I did want to pause if there were any questions on this.
Yeah, Heather, could we go back to data timeliness? Thank you. And we just want to encourage HMS agency admins and users. Data timeliness is one of those goals that would be, we'll see improvement over time. So it's important to review and ensure that staff is entering data in a timely fashion with the 3-day threshold, and over time we will see this improvement with our data. So it's good to run our timeliness report to ensure that the staff is meeting that threshold, and also trying to find any gaps and supporting with that. And please feel free to add any questions that you may have about the quarterly data quality report cards. We're happy to answer any questions that you may have. Thank you, Heather and Andrew. I don't think I see any questions. We can go to the next slide. Hey everyone, I wanted to bring up this topic. Our HMS team has received this request in the past, and we wanted to bring it back to the data and performance management meeting with everyone to further discuss. The request in the past was to add the physical address of the housing placement for participants. So we wanted to bring this up and ask if this is a field that our community would like to add to our custom questions. So this would be for any project type that falls under PH, parent housing. So when a housing move-in date is entered, you'll see on the screenshot to the left, if that date is entered, the following fields will populate at the end of the screen under the OC custom questions. So there'll be a field for address, city, state, and zip code. Wanted to ask if this would be beneficial for a community to track this data in HMS. Please feel free to unmute yourself or add your feedback in the chat. We had a question. We had a feedback that one of our HMS admins said yes, they would like to have this field. And is there a difference between the location tab and the fields on the entry screen? And we also have a question, would this be a require field? And I'll address the required field first. No, these fields would not be required. It will just be available for users who want to enter, or agencies that would like to answer these questions. Similar to our OC custom questions, they are available for us to enter as needed if that's something we're interested in collecting. And we do have another feedback about, yes, this is a good idea. Would like to also suggest adding unit number. And Erin, could you give a little bit more guidance between location tab? I'm also going to search on that as well.
Yes, so the location tab is a separate screen in Clarity. It is most frequently used by street outreach workers, and it will you can either enter address or drop a pin to reflect a client's current location. So you could potentially use that page to capture if the client is in a permanent housing unit. But the issue with that is, number one, you would have to remember to go to that tab and add that. And number two, right now for like our reporting purposes, there's no consistency or no, and we may not know if the address entered is actually a permanent housing location as a result of the enrollment, because it doesn't really link the client's location back to an enrollment. It's just whatever their location is. So the benefit of having it on the entry screen is that the user is reminded when a housing move-in date is entered, they're prompted to put in that address. Number two, we would know that address is associated with that housing placement. And number three, it would make reporting on this information a little bit easier for us because we know that this field is for placements in permanent housing.
That makes a lot of sense. Thank you for sharing that.
Erin, for that support. We have another feedback. We have feedback about tracking may be difficult for housing authorities as clients can move to a new location without exiting a project. So we do not capture what is called term transfer when client move but are still active in project. And we also, I believe, in another comment that is similar tracks initial enrollment, and we would not have a problem entering original move-in address, but once participants are in the program, they could move, and we do not track transfer. The only time we would track anything is if the client disenroll. Thank you so much. We appreciate that feedback to understand how your program operate, and we will further discuss this. Erin, do you have any suggestion? Housing Authority is sharing that they could enter in the initial address. However, there is opportunities for participants to transfer. Would there be possibly another field underneath to track any of that?
I think we'll have to take it back and do some testing. I would not prefer to have multiple fields because that could just get messy. We could also do more testing on the location tab, like Rose mentioned, to see if there's any customization or anything we could do there to help link it back to the enrollment, because that would allow them to put in an entry each time a location changes. But we'd have to figure out how to link that back with the enrollment. So I think we'll have to do a little more testing.
Thank you, Erin. And for our housing authority partners, is this beneficial for your data entry in HMS? Would having the address fields be useful? Because I know housing authorities also have other databases that your agency uses.
I'm sorry, your question was, would it be useful to the housing authority to have this?
Yes, and track it in HMS.
Honestly, no. No, I mean, we don't need it because obviously we have already entered them into our system, and we really do just track them in our system mainly. For the housing authorities, what we do for HMIS is enroll them and basically exit them when we have to exit them. But there's nothing in between that we track.
The feedback. Thank
I
you for
was
your
just
feedback.
thinking, oh, sorry.
Oh, sorry, go ahead.
Just thinking, some of us maybe won't need it or don't want to use it, but some agencies would find it extremely beneficial. And if it's not going to be required, I don't see finding a way to add the physical address to HMIS in some way.
I was going to ask, is it possible and does it occur regularly for agencies outside of public housing authorities? Do your clients change addresses while maintaining the same enrollment as well, or is that a housing authority specific issue?
Had some feedback in the chat that very few times that does happen. As Erin mentioned, we'll continue to test to see different options in adding the location, and we'll bring that back to the data and performance meeting management meeting group. And thank you everyone for your feedback. And sorry.
Oh, sorry. I was going to ask a follow-up. Do you need to keep track of both addresses? Like if so, if they place in a housing unit, do you need that first address and then the second address, or could you overwrite the first address with the second address?
Erin, if you don't mind repeating, you kind of broke up.
I was asking for those, if a client is moving from one physical address to another physical address, do you need to keep that history of both addresses? Or could you replace the first address with the second address in HMIS?
Yeah, it'll be easier to talk than type if that's all right with you. Um, for us, for the Orange County Housing Authority, we already retain that information because of the history of the checks. Even though the checks don't go to the client, they tend to go to the owner, and that may be a different address than what the client's actually residing in. But because we have to do housing quality standard checks before a client can move into a unit, we'd always have, we capture the fact that they've been in a physical unit because we have to demonstrate that they passed. Now with the new Inspire regulations, those haven't even come to action yet. We're still trying to figure out how those are going to apply to other programs. It may or may not apply to the COC, but it's definitely applying to the Housing Choice Voucher Program. So in our case, in the HMIS system, we already do things very differently than what we do in the regular, in our main required system. So it's just additional entry for us, and it wouldn't be initially a problem. It's just a change. So to answer your question, no, if we override it, it would not be a problem. But then I would wonder, do we have to change the move-in date every time?
Thanks for that feedback. Yeah, we will consider what you're saying. I would say no if there isn't a break in their housing, like if they're moving between units and they go straight from one unit to the other in like the same day, and there's no break in housing, you do not change the housing move-in date. I was just trying to troubleshoot the issue of how to track clients changing addresses. So thank you for that perspective. Rose, I was wondering if you had any thoughts as well, if you need to know if you need to track the change in addresses or just the client's current address for their housing location.
No, I don't think we would need to track the history of addresses, just whatever the current is.
Okay, thank you. Yeah, we'll take this feedback and then we will provide an update. That'll probably be at a future user meeting.
If I may add one more, as I'm thinking out loud, point. There's no, that I can think of, and you can help me if I'm wrong, transaction that would prompt us when a client moves from one to another, because we're not changing their grant, we're not changing their assistance, they're just moving from one to another. So that move doesn't hit my desk as an HMIS administrator. So again, it would be adding a different step because it's done by a different team. It's done by the leasing team, and the other team that captures housing, the occupancy standards. So the housing, the number of occupants and their income. Anytime that updates, I get a notice because I can do an interim or a status change in HMIS. But with the physical adjust change, that doesn't cross my desk.
Okay, yeah, that makes sense. Actually, the status update screen could be another option for this to be able to track changes in address. The only issue with that is you wouldn't get prompted to go to that screen when you put in a housing move-in date. But that would be another place to consider this as well. So yeah, we'll provide more updates, but thank you for the feedback.
Are there any other comments or questions?
Hi, this is Julio with Healthcare Agency Outreach and Engagement. I just had a quick question about this because when we do those for us, obviously our clients kind of bounce around because it's street outreach. So I just want to make sure like this isn't going to affect the street outreach programs, obviously, right?
Yes, that's correct. This would be
Okay,
for current housing projects that do enter in the housing movement date when that occurs.
perfect. Thank you so much. I just wanted to double check.
Yeah, thank you for your question. As mentioned, these questions will be not set to required. So if we move forward, we'll provide an update on some options. And again, it is optional for data entered in for your agency. But thank you, everyone. Really appreciate everyone's feedback and input.
Well, thank you for joining us today. If you have specific questions about your projects or specific situations, please submit a ticket to the HMIS Help Desk and we'll be happy to help. Have a great day today.